Good afternoon, everyone.
Good afternoon.
Thank you so much for joining us today. And today is Wednesday, September the 25th, and this is the Suicide Prevention Committee meeting. I want to say thank you for your time and dedication and commitment to this committee. With that being said, I want to go ahead and call this meeting to order. It is 5:34, and we will start with the roll call.
Dr. Judy Bazan,
Present.
Maxine Rivas, Edwin Martinez, Miguel Rangel,
Present.
Maricela Jacqueline, Earl Medina,
Present.
Gabriel Martinez,
Present.
Jaime Montes, Marina Medina.
We have a quorum. Thank you so much, Angie, and I just want to publicly acknowledge you for all the support and the administrative, amazing work that you do for this committee every single day. Thank you so much. With that being said, I want to invite everybody for a small reflection. If you don't mind, just kind of take a moment to clear your head.
Question, we're 9, don't we have to be 5 to quorum?
Good question. Edwin Martinez and Maricela Jacqueline have not been sworn in, so they're not technically members until they're sworn in. But excellent question, thank you, Earl. Any other questions? Okay, so let's go ahead and do reflection, please. Thank you. Everybody just kind of clear your minds for a moment. Close your eyes. And everything that happened in the last 10 hours, just let it go, release it. Doesn't belong to you anymore, it's gone. You did a great job. Let's place ourselves before our Creator. Heavenly Father, thank you, Lord, for bringing us together. Thank you for guiding our steps, for giving us the ability to get up to date and do your will throughout the day. Bless us with your presence as we gather to plan the activities and all the wonderful things that are in store to support the mission of this committee. In your name I pray, Jesus Christ, amen. Thank you, Lord. Thank you, everyone. Next item is public comments. Citizens are required to notify members of their intent to comment prior to the start of the meeting. Comments are limited to 3 minutes per speaker. No more than 3 persons will be allowed to speak on any side of an issue. Should there be more than 3 people who wish to speak on a particular issue, they need to select not more than 3 representatives to speak for them, and the presiding officer may limit the public comments further in the interest of an orderly meeting. Speakers may not pass their minutes to any other speaker. Comments should be relevant to city business and delivered in a professional manner. No derogatory remarks will be permitted. Ms. Angie, do we have any public comments? Anybody that signed up for public comments?
No public comment.
Thank you, Angie. The next item on the agenda is the approval of the minutes for August the 28th, and those minutes are attached. And I want to acknowledge Angie, of course, Becky Diaz and Earl for looking over the information to make sure that everything was accurate, including and most importantly, the motions that were made during that meeting. So I'll give you a moment to read those. While you all are reading that, let me just remind everyone that this is a committee that has been created by the City of Laredo Mayor and the council members. And the members on this committee are the only voting members. However, everyone is invited to provide comments or ideas. But as far as making a motion, only the members can make a motion, okay? Has everyone read the minutes? Is there a motion to approve the minutes?
I make a motion to
Mr.
approve that
Marquez
minute.
move that we approve the minutes as written. Is there a second? Mr. Martinez, second the motion. All those in favor say aye.
Aye.
Opposed, same sign. The motion carries. Thank you so much. The next item on the agenda is a committee membership update. And I do wanna go back to the members that were appointed to these positions. Edwin Martinez with District Two has not been sworn in, and Marisela Jacobin has not been sworn in. Do we have any update on the membership?
Edwin will be going tomorrow morning.
Okay,
On Ms. Jacqueline, there's no update on that.
no update on that? Okay,
But they are aware.
thank you. And then with that being said, we do have a, certificate of appointment for Mr. Rangel, where he was, he was sworn in to the oath of office on August the 28th, so Mr. Rangel, I'd like to present you with that certificate. Congratulations, and you're wearing the perfect button. Look over there for a picture.
Alright, 1, 2, 3.
Thank you. Congratulations. The next item on the agenda is the City of Laredo Police Department monthly report. And we have the lieutenant with us. Lieutenant?
Yes, thank you, Dr. Lassan. We'll start with our monthly report. This, has everything for the year, as far as the calls that are classified as, suicide calls, suicide reports. You can see this year that, attempted suicide calls are already at 96, suicide reports are at 45, in comparison with, 37 of all last year. We do have one more to report of a suicide resulting in death. At 14, emergency detention reports at 532, and our emergency detention calls at 654. Last 3 months, we have one deceased person report as a result of suicide. We'll get to the further detail with that. So you can see, these are all the case numbers, dates. You'll see the sex, whether, the ones highlighted in red are of course the deceased person reports. The method is also there. Cutting, pills, ideations.
What is GS study?
Gunshot wound. So this is one that happened on the 16th, on Monday, September 16th. Police responded to residents at the 2900 block of Galveston where they encountered a 63-year-old male who was unresponsive. He had no prior MHMR history, a medical history. He had, within the last year and a half, he did have some back surgery. There were some pain relieving narcotics being administered to the patient. This was also the result of a traumatic event, which was the vehicular accident. So it's more of, from what we gather, it was along the lines of a lot of coping, a lot of adjustments. I know at the last meeting we mentioned keeping in mind with these traumatic events, we had done an approach with the support group for the stroke survivors. And that's another thing we're also preaching to our personnel to consider, that people that not necessarily have the history, the mental health concern history, but those that have just gone through traumatic events. What we have seen this past month and a half are postpartum. We have seen a lot of postpartum. It was somewhat of an anomaly. About 2 weeks ago, I believe there were 5 or 6 in the same week. And they didn't necessarily lead to suicidal ideations. It's just the crisis. On the lighter note is that we do have officers that call us with questions all the time, and they are recognizing 988. The last was 2 weeks. If there's a case that we can refer them to 988, we can refer them to 988 anytime. Also make it known to them that it's not just a call. Sometimes having that interaction, I know times have changed, but a lot with the younger generation, they don't necessarily, feel comfortable with having that interaction, so the text method is also being, put out there.
On that line, if you call 988 and you want to help somebody, you can get education on the 988 about what to say to them, to help you present it to them, in case they don't want to call themselves. You can call for them, and that can help you make a better presentation to them. So I just learned that thanks to my wife.
And again, we put these, heat maps on. The one on the left is the cases of, for the year. That's a map of Laredo. And you can see refer to them as hotspots with the red, circles. And on the one on the right, those would be the calls. So the ones on the left are actually the reports that are actually made. And again, this is just a reminder. I know we have some new faces here in our meeting, but this is a reminder, to let everybody know that we're not exempt from this concern. It does affect everybody, regardless of demographics. Thank you.
Thank you. Thank you, Lieutenant. Can we just take a moment of silence for people that we have lost? Thank you, everyone. Please make sure your phones are on silent, so that we don't interrupt presentations. So the next item on the agenda is the update on the current projects, and I know that Laredo Public Health probably has some updates for us, Dr. Chamberlain?
Yes, ma'am. Feeding off of the conversation and discussion from the last meeting, we wanted to share some data. Thank you so much to Ms. Erica and Ms. Adriana for helping me put this together. And I wanted just to remind the community of the Laredo healthcare assessment that was conducted and published in 2023. This is still very much valid data. As we know in the scholarly peer-reviewed academic world, it's 5 years, then we got to get some new stuff in. So this will be something that we look to update in the next couple of years. But I wanted just to remind the community that Laredo ranked last in the US with only 8 mental health providers per 100,000 people. That does include, of course, our telepsychiatric docs that are zooming into the city. So physical bodies is different from that 8, but it's 8 with licensures here. Webb County ranks 65th in Texas for the number of psychiatrists per 100,000 population. There are currently 8 psychiatrists in Webb County, resulting in a ratio of 1 psychiatrist for 34,523 residents per psychiatrist. So that is really, really bad, and that's if we had physical bodies, right? That's 1 to 300,000 right now, basically. The gap in psychiatric care in Region 11, which includes Laredo, is projected to increase by 40% over the next 10 years. An expert panel recommended at minimum 30 inpatient psychiatric beds per 100,000 people, which would require Laredo to at least have 78 psychiatric beds in Laredo. Psychiatric patients admitted to emergency departments in Laredo experience long wait times, costing the system significantly and impacting the care of other patients. Inpatient psychiatric patients remain in the emergency department 3.2 times longer than non-psychiatric patients. So if you haven't had the time to review this document, there's a QR code there. You can make sure to cite it for any of your future award opportunities, for any speaking points. This is definitely a great tool for you to have, and if not, I'll also have Ms. Andy push this out to the group. So just so that you know, when you do get the presentation, the link, you can actually click on the document, just as so, and then it'll take you to the actual document itself. This is some interesting data that Ms. Erica shared with me. Texas Severe Mental Illness Resource. So it's the state psychiatric hospital bed availability, treatment, and emergency evaluation laws, support and resources for family and individuals affected by SMI, legal guidance for involuntary commitment and court-ordered treatments, advocacy and research efforts to improve mental health policies in Texas. So you can find that information within this website, which is embedded into the link down below as well. But what was really interesting to me is to see this graphic from 1955 where we had 16,445 beds, and now in the state of Texas we have 1,500.
Wow.
This is bad.
Yes.
Very bad, and this was very powerful to see. So I wanted to make sure that this community, our committee, knows about this. And which brings me to the conversation that we had where we put together the letter. So that was brought up last time, where Laredo Public Health could draft the letter. We have drafted it. This is a copy that is being sent to Senator Zaffarini. Of course, one will be sent to our representative Richard Raymond as well, to make sure that we are advising them that we need to scale up this number that we just saw right now at 1,500 across the state of Texas, which is horrible. That this level of care and support is not there for our people, and our population has tripled since the 1950s. With that being said, that information that I shared from the SMI, from Texas, and of course our HMA, that is included into this letter. So also with that, you all will be able to click on this link. This link will take you to the draft letter where you can just, and we have their addresses there as well, where you can fill in your name, your title, your organization. Of course, you'll change this to Honorable Richard Raymond or Senator Zaffarini. Fill in your role, fill in your organization. You can make any edits or tweaks to the document as needed. And then of course you would sign your full name, title, and organization, place it on the letterhead, and send it in. This is saying you want to bring an annex of the San Antonio Hospital to Laredo. 24 beds, that's still winning, right? We know we need 78 beds, but anything is gonna be a win for this community. And I would encourage you to even print out that graphic where we see the 16,000 to the 1,500, so they can have that power also behind any type of legislation that can be built for the 89th legislator. And right now is the time to let them know, because they are drafting their bills, they are pushing stuff forward, so when they get there in February, it's time to work. And this is something that we absolutely need to work on across the state of Texas, but even more so because we are Laredo, from Laredo, and we want this service to exist in our community as well.
Great. So this is gonna be made available to us?
Yes, this presentation will be sent to everybody, and so that blue link, you'll click on it, it'll take you to the document. You can cut, copy, and paste and put it on your letterheads.
I just have a quick question. If we were to do that, is there any way that we can add maybe like a signature page where other people sign off from our entity? That they
Absolutely, I
agree
mean.
with us, so that maybe
That's a good idea.
it'll be more powerful, more people instead, or do we?
I mean, we want everybody in this room to send an individual letter, because the
Right,
more
right,
letters
right.
that go in, the better. But I mean,
Like,
from
I'm
your
just saying, like,
organization,
from
if
our
you wanna have
district.
500 signatures, power to you. I mean, that's more power behind that one letter that has additional signatures, demonstrating this need for.
Those are more voters, so that's important.
Yeah.
Excellent.
Good idea.
Thank you.
So of course, this is just a copy of ours, as you can see here, what we're pushing out, the way we presented it, and this will be mailed out to Senator Zaffarini and Richard Raymond tomorrow morning. So we're starting it out for y'all.
Thank you. Perfect.
I did want to bring your attention to an updated logo. I wanted the committee just to see these, and then we'll send it out and we'll poll everybody. Because I know that the logo that we do have right now was made by me in 2019. And I feel like it's not reflective of the movement behind the colors. And so I asked our Marcom teams, thank you Deidre back there, to put these together. So that way we have something for the group to update, to give us that revamp, but then to be in congruence with the colors that are representative of suicide prevention. And so these are just some for y'all to look at. We'll send them out via link for, I mean, the whole group can definitely take a part in this, because this is for the community. And we're asking the community to be involved in this decision, because this is reflective of the committee that is representing the community. So this is just for some consideration. We can bring this back next time, but I just wanted to let the group know that we did work on this because I did ask our team to actually revamp our Blue Ribbon Committee, our Drug and Alcohol Committee. I'm missing one more.
This one.
This one, but there was one more, no? More? Okay, no. No, we haven't gotten to lax yet. But yeah, so we worked on revamps, so we just want to make sure that the group was aware of these revamps as well.
Can I make a suggestion on those logos? Can
Sure.
you, send them to us but numbered, and then people can say, well, I like number 1, I like number 2.
Yeah, well, we're gonna do a survey, so you can click on which one you did like as well.
They're all mine. They're all very nice, very nice.
Thank you, Dieter. And take any questions if there's any.
I just wanna publicly thank you for, I know we talked about it last month about drafting the letter. Thank you for being very proactive. And thank you all, and let's move on that because it's, we need that help in the radio.
I just want to say that I've been here for many years, and Dr. Chamberlain and your entire staff, wonderful staff I have the privilege of working, you have taken the Laredo Public Health, City of Laredo Public Health to a whole new level.
Absolutely.
Thank you.
And I was on a committee with you not too long ago. And I know Richard's the first one to say it's all of you. You've taken it to a new height. We were on a committee the other day and people were very, very impressed with you. I think that, and we need, when we say you, your staff. So God bless you all and thank you for making Laredo proud. The City of Laredo Health Department is number 1. I think, and I've been around, so God bless you.
Thank you, sister.
Thank you, sister. Any other comments or questions on Dr. Chamberlain's report presentation?
I have a comment in regards, I know the state hospital beds look low, but what's more impactful is that a huge percentage of those are forensic. So they're reserved pretty much for individuals that are incarcerated, so that's not even open to the public. So technically, those numbers open to the public are a lot
They're worse.
They're lower.
lower.
Wow, thank you,
Yeah.
Erica.
Wow. Thank you for pointing that out. That's very important.
Do you wanna tweet that in the letter?
Yeah, I can.
Oh, you did?
I'll try, no, I don't think I
Okay.
have, but I'll go ahead and change it,
Uh-huh.
yeah. No, but I don't understand. Yeah, I think I found it on that SMI website I
Looking
sent
through
you. It
reading the
mentioned there,
Small letters.
yeah, that it's still reserved for forensic, which used to be Curvo, now Stash is also taking in forensics.
And I think those are important details we need to make sure that we highlight in conversations with people, with leaders, whether it's here in the state. You never know who's gonna be in the same room with you, so taking that opportunity and thank you for educating us on this so that we can feel prepared to have a discussion when the opportunity presents itself.
I think it was when President Reagan was the president, we closed oodles of staff services and they put them out. But we should do some kind of a history on that, Richard. When he did close them, and they were all over the state. When I was in Missouri at that time, they had public health, mental health hospitals. And what they said that they weren't meeting up to high standards. So they closed them all. And they said that's when the people were out on the street, and that was a horrible, horrible thing, but he was championing for it. And maybe if we could do some kind of a historical thing, because there were a lot of mental, people were shaking their heads, they remember. But they said, well, they weren't getting the best care, but they were getting the care. But they do, we need more. This is desperate.
Mhm.
The letter, I'm sorry to interrupt, the letter does mention that we had a, as amistad, that Yo was a psychiatric hospital that closed in 2019.
Thank you.
So we did have one before
But,
2019.
like, those of you who are very, very young, probably don't even know
But
that. But I remember when I had just graduated from college and they had, or maybe I was still in college, remember they had Laredo Charter Hospital here in Laredo? It was in the 80s, right? Like,
Corner Springfield.
yes, they might say it.
Springfield got enough.
Yeah, it was there and. yes.
I'm not sure, but, so I was living in hotels in June. My kid went to TAMU, so we came down from San Antonio Monday through Thursday. And so I was at Motel 6, and I think it was a suicide watch at Motel 6. There was a young person, a police escort 24/7 standing outside the door, and they would just walk around, and so that's what the children have to put up with in Laredo, and that's not right.
Thank you, Mr. Franklin. Anything else, Dr. Chamberlain?
This will be pushed out via email. Thank you, Andy.
So make sure that those of you that are present today sign in with your email, just in case we don't have it. Thank you so much. Any other questions or comments for Dr. Chamberlain before we continue? I want to invite the members of the committee to make a motion that we acknowledge this very important report, and that we publicly acknowledge the work of the Public Health Department staff to bring us this information. So can someone make a motion?
I'll make the first motion.
I'll second it.
Seconded by Mr. Banjay. Those in favor say aye.
Aye.
Opposed, same sign. Motion carries. Thank you so much, Dr. Chamberlain. The next item on the agenda is You Are Not Alone awareness activities. And it's just an update, and I think that we kind of circled around some of the activities that, first of all, I just want to say thank you to all of you around the table for your commitment, your participation in all the activities. Some of you attended one, others attended all of them, others attended none, but I know you were there in spirit, because sometimes our jobs, demand other things of us. So everybody around the table needs to be recognized for the efforts that took place from the very beginning with a proclamation at the city, and then proclamation at the county, and different rallies, and different events at the football fields. So these things were passed around. There's 2 pages of community partners activities, and then 1 page of the AHIC team and students. So I just wanted to bring that to your attention, that I am so proud of our community, and much more so of this committee, because we believe in what we are doing, which is 988 is available for everybody in need. So thank you for that. September's not over, and so we still have more to do. That's why we're sitting here. This Friday, as you can see, there will be another rally. The AHIC volunteers along with the staff, and I know Dr. Chamberlain joined us, and Laura and Rosina, and some people from SCAN were also there. And let me see who else was there. Some of the committee members were there, too many to mention. So we identified different locations throughout the city, and every Friday in September we have been doing this. So this coming Friday, and you have the package in front of you, it will be at the corner of McPherson and Delmar, the Bank of America. We have the signs. All you have to do is show up, and we choose locations where it's very safe for us to park, and we're not in the way, and you'd be surprised how many people are touched by the message, just by reading the You Are Not Alone. And this is what it's about. So I invite you, if you're available, come and join us. This will be the last rally for September. And I don't know if any of those of you that were present at the rallies, if you want to make any comments or would like to add to that report.
I do want to say the first Friday, with Dr. Judy, we were at the corner of Calle del Norte and Springfield. And we were there, it was super fun, we were there with the signs, and one individual stopped her car, parked, and said, "Oh my gosh, I'm so glad I saw you, I need help." And she, because we were there, she came and he was able to, refer her for help, because she saw us. So it makes a big, I mean, it was one, but that's one that got off. How many saw that and got, were aware, made aware. So good work, team.
Thank you, Rosina. Anybody else that was present? Becky, would you like to add anything?
I think overall it does make a difference, the numbers of people that show up, because they'll see a group of people and they're like, what is that? And it's something that they're gonna see on their commute, and then talk to whoever they see first when they get to their offices, to their homes, and it makes a difference. There were people who did, like, from their window say, like, what is that? And I did, like, scream back so they could hear. And he's like, I didn't know that. And, like, these are things, again, so, like, you were talking about earlier, how you think that everyone at this point should know. They don't. And so, yes, 30 minutes at the rally, it does make a difference, and it would really help if everybody showed up from the different agencies and just come out and hold up the sign for a little bit. make that impact for somebody in the morning.
And the rally is only 30 minutes long. We're not there all day, and it's early before the sun comes out. I know Dr. Chamberlain was there, like I said. So join us. It's something that, it kind of gets you going. I felt really energized after doing the rallies. You felt like you were doing something good. It didn't cost anything, and you were out there just waving and saying good morning to people, bring that smile to their face. So everybody received a list of all the activities that were planned, and many of you attended, so thank you for that. The other update that we have is on the posters that David Vasquez from Gateway Community Health Center is trying to get us. So he sent me a draft of the artwork. You can pass it down. It's nothing different than what we're already promoting on the banner. It'll be a two-sided, you're not alone on one side, and the other side will be No Estás Solo, with a QR code for the mental health resources available for people. And all we're pending is to pay for the posters, because the sponsorship that we had fell through. So if you know of anyone that would like to sponsor, if you have any funding, you have some funds?
No, I don't have funds, but I know someone who has
Okay.
funds.
Well, if you know that person, then I know that person.
Yes, you do.
So please, let us know, because remember, everything we have purchased, including those buttons, we don't have any funding for. What we've done is we bought them and people pay us. We did have a sponsor that gave us money for the buttons. And then we had, an angel that gave us money to print all the signs or the banners. And I say an angel because they believe in our cause. And this is when you know that what you're doing is good for the community, when other people come forward and say, here's this money so that you can get me that. So pretty soon we'll be having posters. Remember, this will be made available for the downtown businesses, the R&R businesses. And anybody else that wants them. Once we have a sample of one of the posters, I thought about approaching Danny's. How many Danny's are in town? Even if they don't have them at all the tables, but you know, they have like a little bar area in the restaurant. So that's what I would like to do. And
Maybe
of
they
course,
put them in the bathrooms. Maybe they put them in the bathrooms.
that too, sister, yes. Any other questions or comments on this? Yes, Ms. Miranda.
What amount are we looking for the posters?
I'm sorry?
What amount?
Um,
What's the first expenditure?
I wanna say, and don't quote me on this, I think it's $147 each,
$1.47 per.
each poster.
Okay.
Remember that the more that you buy, the less, so I think we're looking at something like that. The shirts for the 98, everybody has, most of the people that have wanted to get one have gotten one, and you can see from the different pictures and activities, people have worn them. We wear them every Friday at our office, and that's something we're gonna continue doing throughout the year. We're not gonna stop just because September's over with. Any other comments or reports on the 98?
All the vigils were beautiful and well attended, and I think they were helpful because they got on the news and the newspaper. So I thought Lower and all the
Yes.
other ones, the one at the library also was attended well, and I just want to thank everybody for everything you did.
And the college and the university and the school districts, everybody got on board. And I do want to acknowledge Laredo Morning Times for being at all our events and highlighting the work that this committee, this volunteer group has done to create awareness, because nobody's getting paid to do it, it's all volunteers. And it's important that you take pride in what the results are. Because not only are we creating awareness, but we're also extending that lifeline to someone that might need it, so thank you so much for that. Okay, any reports from, Mr. Martinez, how's Bethany House doing with the activities that y'all are providing there?
Yes, we're doing fantastic. So every Wednesday we're there, and we're getting more and more, clients coming in and providing them the assistance. We take some 988 cards there and I hand them out to them. So it's been a productive site to be at.
Thank you so much. Earl,
Yes.
anything to report?
Right now, I don't have anything, just on Friday, right here at the Laredo Public Health, we're gonna start with, World AIDS. They're gonna be doing some, testing, so my organization will have a booth there to represent, as well as, we'll be, showing off the 988 banner as well, and of course, wearing the shirt.
And when is that?
This, it's this Friday from 2 p.m. to 6:30 p.m. It'll be, downstairs,
Maryland side.
Maryland side.
Okay, perfect. Mr. Angel, anything to report?
No, just I want to thank everybody on the committee for going out and being present. Dr. Chamberlain for taking great photos and posting them. And everybody's been very helpful. So, and I've seen a lot of you at all the events, so thank you very much.
I know that Border Region also had a great event where we all took part in, or most of us, in the walk and creating awareness. So everybody came on board with whatever ideas they had, and I know many businesses had the banner. So with that being said, thank you all again. I cannot say thank you enough for all your efforts. Of course, thank you to the police department for keeping us informed of the activities that we wish were not there, but we have to.
But that's why we're here, because they are there.
That's why we're here, that's right. With that being said, I do want to introduce some of our public health students. So why don't we go around the room and introduce ourselves, the name and who you represent. So Becky, let's go ahead and start with you.
Good evening, everybody. My name is Becky Diaz. I'm from Area Health Education Center. I'm a Special Projects Coordinator.
Hi guys, my name is Ajatza Perales. I am a senior at TAMU. I'm supposed to graduate this upcoming semester. And I'm with Area Health Education Center. And I want to say, Dr. Chamberlain, I actually took a class with you, I want to say last semester, 2 semesters ago. And it was so much fun. I really enjoyed learning from you.
Hi, I'm Sarah, and I'm also a public health major, and I will be graduating next semester in May with a bachelor's in public health, and I was also one of your
I
students.
remember your name. You never get to see them in person because we're a virtual realm, so it's wonderful to connect with you on
Yes,
see
your
the
name
faces
was so
that I
familiar.
remember in the course rooms.
Yes.
Adriana Morales, Public Health Department, and I'm the harm reduction specialist.
Erica Lopez, Director of Public Health, Disease Intervention Manager.
Ariana Rodriguez with our public health, and I'm a caseworker with AMT.
Earl Medina, I'm president and founder of Orgullo Laredo Youth Safe Haven and representing District 5.
My name is Evelyn Chapa. This is my second semester at AHEC, and I just wanted to thank Dr. Bazan for allowing me to be part of AHEC. I love it there, and I also remember you.
Remember you all saying.
Sister?
I'm Sister Rosemary Walsh, I'm from Casa Misericordia University Training.
Hello, Melissa Davides, Director of Guidance and Counseling for United Independent School District.
And Rita Gonzalez, Health Services Director for UISD.
Miguel Rangel, citizen of Laredo now, and San Antonio still, and representing the Licenciado in District 3.
Hi everyone, I'm Juan Rodriguez and I'm a licensed professional counselor here at the Laredo Public Health Department.
Hi, I'm Yannick Mireles, I'm with SCAN. This is my first meeting, so I'm extremely intrigued and interested in the stats that were provided today. If I can just make a quick announcement, I'm a counselor with SCAN. We're having a suicide awareness walk, actually tomorrow, Thursday at 7 p.m. at Independence Park for anybody who wishes to attend. And if you have the t-shirts, please wear the t-shirts as well. If you don't have a t-shirt, purple's great, the turquoise is great also. So yes, I provide mental health services at SCAN.
Sorry for the other new guy. Where's Independence Park?
Because I haven't gone in quite some time.
It's in Southside.
It's Southside, yeah.
We'll send everybody the address, so that way if you want to go with your team, you can show up.
Yes.
Oh, good, thank you.
I wasn't extremely prepared, but
That's okay.
I was aware.
You know what, if you give Angie one of the flyers, she'll send it to us.
Perfect.
Yeah, you can put it on the WhatsApp. or
Okay, next.
WhatsApp or something.
I'm a reporter for the Times.
Thank you for being here.
Next.
Hello, my name is Crystal Sula and I work with the Webb County Community Action Agency and I'm a caseworker there.
Thank you for being here.
Thank you.
Good evening, I'm Tony Guerra. I also work with the Webb County Community Action Agency and as a caseworker.
Good evening, I'm Robert Garcia, I'm a lieutenant with the Laredo Police Department. One of the divisions that I oversee is the mental health unit. I know it works a lot with a lot of different agencies here. Chief Gonzalez Ricardo Gonzalez was supposed to make it. He sent his apologies, something came up last minute. I was texting with him right now as far as the rally for Friday, but maybe incorporating maybe some marked units, get the lights going on.
Oh, that would be great.
So,
Yes.
so far, it looks like it's a green light on that, so we just need to make some last confirmations, but we'll try to.
Excellent, thank you so much.
Lieutenant, what were the names of the people that were at the library that also work for the police department that provided?
Those were our mental health officers, which is Officer Gilbert Ramirez and Officer Jacqueline Davalos.
Yeah, they were very interesting, and it's good to know that you have mental health officers at Laredo Police Department.
Yes, Laura?
I'm Lara Cortez, and I'm the Director of Special Programs and Projects at Puerto Region Behavioral Health Center.
Thank you. Good evening, I'm Rosina Silva. I am a retired educator and I am an AHEC scholar. I got my CHW license because of Dr. Judy, and I'm a volunteer. This is a great passion for me. Thank you for having with us. Thank you.
And I'm Dr. Chamberlain, Laredo Public Health Director, also a professor of public health at the university, and also serve as the Wellness Equity Alliance Senior Advisor for Border Health.
Gabriel Martinez, licensed professional counselor at Gateway Community Health Center and representing District 6, appointed by Dr. Paddock.
My name is Yolanda Martinez. I'm an intern at AHEC, and this is my first semester as a senior with Public Health at my major.
Thank you so much. And I am Dr. Julie Basan. I'm the committee chair for this wonderful group of people, volunteers that are so amazing, and you inspire me each day. But I'm also the executive director of the Area Health Education Center, the best AHIC in the nation. Yes, I will say it because I believe it. And Irene Rosales is on our board. She's our vice president, so she can also say that. I want to just call your attention to this little handout, because in here you will find some very important information about some events coming up in October. We have the Youth Domestic Violence Awareness Conference, and we have the 28th Annual Domestic Violence Conference that is happening October the 3rd. And this has been going on in collaboration with many agencies, right, sister? Would you like to say something about that?
No, I just think it is, when you think 28 years we've been doing this, and I think one of the successes is that we have a committee that works on it. We don't know who gets credit, we just try to get it done. We have a coalition that meets once a month at the hospital and Laredo Medical Center. They're very generous having lunch. It's the third Wednesday of every month. They have lunch. It's 11:30 to 12. We don't have any officers. We don't have any bylaws. We don't, just 6 or 7 agencies hold a meeting together every month. And many of the agencies sitting around here come together, and it's just to do the stop domestic violence. This is going to be really, they're going to have a training on strangulation. And it's going to be I think it's 4 to 5 hours. But it's 2 sessions, because and as the police officers speak to it more than I, but sometimes that's what leads to death. We see that, and that there's a lot of warning signs, and it's going to be a very professional training. And then you're also going to have something, Dr. Salinas from the university is going to be talking, and also they're going to have a brief little show and tell 101 domestic violence. Sometimes people say, I didn't know that. So I think it's got a very good conference, and we've been doing it for many years, and it's just at the university, we don't pay the university, but we have to charge something so we can pay for the food. And then, of course, they put in there the speakers that come. So if you still have some time, you can still register. And I think it's something I think Laredo can be very proud. People are surprised to get so many people, and that people are able to come and get a lot of PR. We need to continue to talk about domestic and dating violence, because we always work with the schools very closely. Anyway, so Ms. Basan, Dr. Basan is also in the committee. Fabiana is not just and a lot of other people. It's not just 1 or 2 people, it's about 8 or 9 or 10 people that pull it together every year. And how we come up with the topics, we ask people after you go, what would you like next year? And that's what we look for. so we can, it's not our conference, it's the community's conference. Thank you.
Thank you, sister. I do want to just apologize and an oversight of mine, but our board member at the Area Health Education Center is also Dr. Richard Chamberlain, so I want everybody to know that my boss is sitting right next to me. So the youth domestic violence, this is virtual, so if you know anyone that lives in Zapata, Stark County, anywhere in the United States, they can attend. It's for middle school and high school students. It's gonna be a wonderful program. And Sister talked to you about the annual domestic violence conference. Every 2 weeks, we have a virtual mental health gathering. As you can see, the next one is Friday, October the 4th. Dr. Gilberto Salinas will be talking about mental health. And this is something that we started when the pandemic started. And I say this because I'm very proud of the initiative. And we continue to serve people virtually every 2 weeks on different topics related to mental health. There is no cost. Anyone in the community can attend. You don't have to be a medical provider. You can be a teacher. You can just be a parent that maybe you're retired, you don't have anything else to watch at home at that hour at 1:30. Help them register so that they can learn. I've learned stuff related to mental health. The other one that I promised Cynthia Ramirez-Haynes that I would talk about at this meeting is the ALS support group that the Area Health Education Center started. We meet every third Tuesday of the month. And the next one is gonna be Tuesday, October the 22nd from 6:30 to 7:30. So please, if you would like to learn more about it or know someone that might wanna learn about it, let them know that we're having that. Then the next, of course, is the annual Updated Medicine Conference. Part of the program is going to include a neurologist that will talk on ALS. That was one of the promises we made to the group when we started the support group, and we will be bringing the doctor to talk about that. The rest, I know it's early, but guess what? The staff is already on board and so is the bishop. Red, white, and blue mass for all the veterans in November, and the bishop will be officiating the mass, so please join us. There's going to be a reception afterwards. And the rest is just, we continue to have events for our students throughout the year. Any questions, comments, or ideas, or anything? I like to be very effective and efficient with the time because I respect everybody's day, and I know we've been working, so I thank you all for being here. I will see you here next month. Can I have a motion to adjourn the meeting so that we can take a little picture? Mr. Garcia, second by Earl. All those in favor say aye. Aye. Same sign. For opposed? No. Okay, motion carries.